Hi, I'm Michelle Lokiao,
I'm Kim Milligan.
And I'm Heather Whittlesey.
and we are presenting our project on home healthcare nursing, which is a huge benefit to our community. I am currently a cardiovascular progressive care unit nurse in the hospital setting, but I have used a home healthcare nurse for my husband when he was in a jet ski accident, and we used the nurse for about 6 months.
And I've done pediatric home health in the past and still currently work for them as needed. And I'm also a wound care nurse at a local nursing home.
And I used to be a home health nurse previously and now a med surg.
The primary activities of a home health nurse is to provide direct and indirect nursing care to patients. The direct care involves activities that require physical contact and face-to-face interactions, such as performing physical assessments, focus assessments, and head-to-toe, changing dressings on wounds, giving injections and medication administration, inserting indwelling catheters or straight catheterization, as well as Foley care. They also provide IV therapy and IV medication administration, and they provide a lot of teaching and education to patients and their families who are a huge part in their care. The indirect activities done and provided for by the nurse is to improve and coordinate care for clients by consulting with other nurses, as well as consulting with healthcare providers in a multidisciplinary approach, organizing and participating in client care in team conferences with other healthcare providers. We do a lot of advocating for patients. So we use advocating with healthcare systems and insurance companies, which really dictate their care. We supervise and delegate to other home health aides, and we obtain diagnostic test results and go over those results with the patients. And we, of course, document all of our care provided. The scope of practice for home health nurses is to practice in accordance with the scope and standards of home health nursing practice. These standards are developed by the American Nurses Association. These standards periodically change and are revised to reflect ongoing changes in our complex healthcare field. Other specialty professional organizations guide population-focused home health care, so specific specialties are also dictated. The American Nurses Association Standards of Care contain the 6 steps of the nursing practice. So ADPI, that includes assessment. Focused head-to-toe assessments for our patients are very important and vital. That leads us to a diagnosis for our patients, so helps us to develop our plan of care, and also to determine the outcome. So we're identifying outcome. We're planning their care based on that assessment and diagnosis, and then implementing that care by providing whatever is necessary. And then we will evaluate what that outcome is going to be.
Standards of professional performance. Scope of practice also includes quality of care. We have to provide a high level of quality of care to our clients, and we're going into their home, so we need to treat it as such. Performance appraisal. Are we able to perform our duties to the highest specificity and feel confident in performing our duties? Education level. As you'll see later, the baccalaureate degree is highly recommended for any community health setting based on the knowledge that we gain from the associate nursing degree and then the research education that we obtain with the baccalaureate degree. Collegiality. How high do you want to go? You can go all the way to a doctorate degree in nurse practitioner or an ARNP. It depends on how far you want to go in your education. But any of the education levels can be performed within the home health setting. Ethics. Depending on the home setting that you go into, whether it's an abusive home, it's a single parent home, it's a clean home or a dirty home, we're held to ethics and higher standards, and able to keep the confidentiality of our residents or our clients within just the clients and us. Collaboration of care. We collaborate with different healthcare providers to be able to send the clients out if need be, depending on the acuity of their disease process. Research. Are we able to research for ourselves using Google or YouTube or our book prior to consulting another healthcare provider to get that next level of information to be able to assess and treat the patient or send them out? Resource use. Again, are we able to use the resources that are provided to us, whether it's our books, it's YouTube, um, any medical journal or anything like that? Are we able to research it and use it for the betterment of our client? Teaching and learning strategies. As a home health nurse, we need to be able to gauge the client's level of education and ability to participate. Are they, a 12th grade graduate, or are they a ninth grade dropout? That would gauge how we teach them and what kind of education we provide to our client. We provide hands-on training and encourage participation in the teach-back method. Are we able to give them the training that they need, and are they able to teach it back to us in case we're not in the home? That way they're able to provide care for themselves the other 23 hours of the day if we're only there 1 hour of the day. When implementing any new therapy, we teach by showing and discussing therapy and procedures simultaneously, such as applying a wound vac. Are we able to teach them how to window the wound, how to apply the clear tegaderm and bridge the sponge over to take it off of the bed of the wound and still allow for a good seal to be able to suck out or vacuum out the secretions? Then allow clients to ask questions or state concerns, and we can give further direction and feedback. Do they have questions or concerns about applying a wound vac, like what the technology is, how they're doing it? Once the client is comfortable and confident with any new therapy or procedure, we allow them the ability to independently perform under our supervision. Are they able to window the wound and apply the clear tegaderm with bridging and all of that, and be able to get a seal for the wound vac to be able to work properly? Educational preparation for the job. As stated before, while you can practice as a licensed practical nurse or a registered nurse, a baccalaureate degree should be the minimum for any community health setting, just because of the degree of research that we have done within the bachelor setting and being able to research to get information to better help our clients. This allows the home health nurse to function in the role of a generalist, providing skilled nursing and coordinating care for a variety of home health clients. Performing as a generalist, do we have the critical thinking skills to be able to come in and see if our patients are acute? If they have congestive heart failure, can we see that they have labored breathing, or they've put on, weight gain of 3 to 5 pounds in a week? Do they have dependent edema? All of these things we would have to assess and be able to gauge. Do we need to send them out, or do we call the doctor and increase their Lasix to be able to get the fluid off of them? In the home health setting, you're required to work on your own, make sound clinical judgments, but seek help and additional direction when needed from other healthcare providers. This was stated before, are we able to use the resources available to us to be able to kind of research on our own and get some of that information before we go to the next step and say, hey, this is what we found out, but this is still kind of my question on what to do and where we need to go from here.
Working in home health, you're oftentimes by yourself, but oftentimes we still do work with other professions as well. These responsibilities and functions are often dictated by Medicare regulations, professional organizations, and the state licensing boards. To provide successful interprofessional collaboration, there are a lot of things that we have to take into consideration. Three main ones are our knowledge, our skills, and our attitudes of any team member that has interaction with our patients. First, knowledge. We have to understand the group's process to achieving our goals, which is to improve our patients' quality of care and quality health. We have to understand the measures taken to solve the problem, the different roles that each professional is doing to help with our patient, and how they view their roles. And as mentioned before, our patients' acuity levels across all the different cares we provide for them. Next is the skills that we provide. We have to be confident in our skills and be able to communicate to them clearly. Oftentimes, we don't want to use our professional jargon because these patients may not actually understand what we're saying to them. We have to bring it down to a certain level for them to be able to understand it so that they can eventually be able to care for themselves. And we just need to learn how to express ourselves clearly through that way. Next is our attitudes. Going into these homes solo, you have to be confident in your role, in the care you're given. You have to create a trust and respect with other professionals and trust and respect with the patient. We have to share what we're doing with other professionals as well as they teaching us how to better care for our patients. We have to work effectively and ask questions along the way to resolve any situations and be flexible and timely because we are taking time out of the patient's schedule to go in there and help them. So learning how to be flexible with everything is key. Going into home health, there are many skills that we have to know and understand. First and foremost is wound care. Oftentimes, home care is wound care, unfortunately. And so understanding all the little things that we have to do to help promote this wound care. Next is IV therapies, whether it's 2-hour long infusions or 15-minute infusions. We have to be able to understand side effects and be able to know what to do in case something goes wrong. Enteral feedings are often tracheostomy care. How to care for a colostomy, especially if it's new, teaching the patient how to care for it, how to drain it, what to do in the case it does leak, and certain information. Oftentimes we see Foley's, nephrostomies, suprapubic care to help prevent infection for our patients and just give right care and understanding of how the patient can take care of it. We've seen biliary drainage systems, and we work a lot with PT, OT, and speech therapy. And diabetes management is a big one in today's society, and teaching them what to expect, how to prevent blood sugar levels going up or low, and just teaching them how to prevent that and what to do in the case it does happen. And while learning everything about home health and certain situations that we've interacted with, just seeing wound progression heal from a big gaping wound and seeing sometimes day by day or weeks by weeks the progression of it healing and just the whole body healing itself. Also, having the opportunity to interact with family members in their comfort level, and whether it's parents teaching us how to do G-tube feedings and what works for their child, or just having the family being able to participate and be an active helper in these situations is something that we don't often see in a hospital setting. And the fact that patients are oftentimes more comfortable as well when we're treating them inside their home. Also, one quick fact that we found out was that if you are a registered sex offender, they won't let you go to a rehab facility, and so we get to deal with them in home health, and that's just something intriguing that we've learned along the way as well.
Thank you so much for listening, and we hope you learned a lot about home health nursing with us.
Thank you.